Good evening to all. I welcome you all for this Pinnacle News Series, episode 16. Now we will start with the prayer and the lamp lighting. Today we have the societies. Yes, you've put. Yes, Sakiti. Yes, Sakiti. I'll start. Madhumita is on travel, no problem. I'll start the program. I welcome you all for this Pinnacle webinar. This is our 16th series. The Pinnacle webinar is the news, Pinnacle News. We take societies, we invite societies from north, east, west, and south. That is the reason it is called as Pinnacle News. Today we have Bereli, Jodhpur, Roorkela, and Vijayawada. The societies participating in this webinar. I welcome Bereli Society President Dr. Latika and Secretary Dr. Anita Nath, and the Jodhpur Society President Dr. Kalpana and Dr. Secretary Dr. Jyota. Roorkela Society President Dr. Sudharani and Secretary Dr. Sujata Kumari, and Vijayawada President Dr. Tripura Sundari and Secretary Dr. Somalata. We have two interesting sessions. One session today, our team is medical legal issues. So first we have a talk by Dr. Somalata. She will be talking on newer amendments in MTP Act. Then we have the wonderful panel discussion with the case scenarios of the medical legal issues in UG. Where Dr. Jyoti Banglawala, she is the chairperson of our Foxy Medical Legal Committee. And we have Dr. Vivek Madi being the expert. And the panelists being Dr. Kalpana, Dr. Ashwin Rao, Dr. A.R. Chanti, Dr. Srisha, Dr. Sugashni, and Dr. Leena. For this webinar series, we have the coordinators, Dr. Radhika and Dr. Madhumita. Both of them are on travel. Now we have the newer entry, Dr. Priya Kannappan. She is from our own Chennai Society. So first we will go with the chief guest address by Dr. Tripura Sundari. Sakiti, can I have the CV of Dr. Tripura Sundari Madam? Tripura Sundari Madam is the president of Dr. Vijayawada OBGN Society. Vijayawada is the very active society in the south. Now I welcome Dr. Tripura Sundari Madam for the best wishes for the webinar. Yes, Madam.
Thank you, Madam. Thank you. Good morning, everybody, and a warm welcome to each one of you. And I am Dr. Tripura Sundari. I am president of Vijayawada Society, Andhra Pradesh. And I am both immensely pleasure. It's immense pleasure and honor for me to be the chief guest of today's prestigious webinar. Madam, this is your brainchild, I know, and really very wonderful way to share knowledge among ourselves. And a warm welcome to all the delegates, all dignitaries, all faculty members, as well as the chairpersons, moderators, and everybody. And I congratulate all of you to bring all the eminent speakers under one roof to discuss the today's topic, that is MTP amendments as well as medical legal issues, which is very relevant of today's times, and appreciate and commend all your efforts. And I thank Madam for giving me this opportunity to be the chief guest of this evening. And this program, this is the Pinnacle's new series, 16th episode, is on medical legal issues being organized by the societies of, Madam has already told, Bareilly and Rourkela, and then Jodhpur and Vijayawada. Thank you very much, Madam. And I express my gratitude and immense heartfelt thanks for you to share this platform along with all of you. And I expect this webinar to be a grand success. Not only this, even all the forthcoming series will be a grand success. It will be a great opportunity for all of us to share this, their wisdom as well as their expertise and their knowledge amongst us. Thank you one and all for giving me this opportunity. Thank you. Jai Hind and Namaskar all of you.
Thank you, Tripura Sundari Madam.
Yeah, I request further proceedings to be conducted by the organizing committee.
Thank you, Madam. Thank you. Now I invite our guest of honor, Dr. Latika. Madam, can you have the CV? Dr. Latika Agarwal is the president of Bareilly OBGYN Society. And I will invite Dr. Latika to give her wishes for this webinar. Dr. Latika.
I'm Dr. Latika. I'm really happy to join this webinar. And I wish you all the best for all the speakers and all the chairpersons, all the persons who are involved in this CME. And thank you so much for inviting me here and giving me this platform. Thank you so much.
Thank you. Thank you, Madam. Thank you so much for your wishes. Now we will go with the scientific session. Dr. Priya Kannappan, can you take over? Can you introduce the chairperson? So now we have the Priya. Now we have the Madam. Priya Kannappan, will you introduce Dr. Anita Nath?
Yes, madam, I will do that. Thank you, ma'am. So, Dr. Anita Nath, she is a director, Nath Hospital of Bareilly. Madam is being a secretary of Bareilly Obs and Gyne Society, member Oncology Committee, the UP chapter of Obs and Gynecology, vice president Brahma Devi Balika Intercollege Bareilly, and a special areas of interest in high-risk obstetric management, safe motherhood, a state-level table tennis player. Very nice, madam, to put that in the.
Thank you so much.
And
thank you so much, Priya.
Over to you, madam.
We can proceed, I think. Thanks a lot.
So can you introduce the speakers, madam? We have another. Sorry. So, Dr. Somalata, madam is a consultant.
Welcome, Dr. Somalata. Yeah. Can I introduce her?
Yes, ma'am. Yes.
Welcome, Dr. Somalata Raparthi.
Yeah, thank you.
She is the consultant obstetric and gynecological society gynecologist in Bhargav Nursing Home, Vijayawada. MBBS from Guntur Medical College, from PSIMS, and she has special interest on endoscopy and high risk pregnancy, affiliated to FOXI, IMS, IMA, ISAR, and she is the secretary of Vijayawada Obs and Gyne Society, treasurer. She has been treasurer. She got very nice to read it. She got special awarded in the best paper in UA FOXI 19.
Yeah, thank you, ma'am.
Sorry, UA FOXI in 2018. Yeah. And she had been panelist in so many UA FOXI and APCOG, TCOG, and had been speaker in UA FOXI, again, FOXI Vice President Conference and SJED IMS Con. So, so many things to speak about her, and very nice to know her. So let's start our talk. Thank you so much.
Yeah. Thank you, ma'am. Good evening, all, and thank you so much, Sampath Kumari Madam, Tripura Sundari Madam, for the opportunity today. And thank you to all the presidents of all the societies. Madam, can I share my screen?
Yes, madam. Yes, you can share the screen, ma'am.
Just.
Yes, ma'am. Your screen is visible, madam.
Yeah, 1 minute. You can see the slides, no,
Yes,
ma'am?
madam. Yes.
Yeah, the topic is like what are the amendments in MTP Act in 2021 and again small changes that have been done in 2024. I myself Somlata Rapatti, and so just by WHO, safe abortion must be provided or supported by a trained person using the tablets or a surgical procedure. It should be a comprehensive, there should be a comprehensive sexual education, access to affordable contraception and safe abortion care. The all the motto is to decrease the maternal mortality rate. Even then, every day 10 women in India die as a result of abortion-related causes. So terminating pregnancy is the choice of pregnant women and a part of her reproductive rights. That is the one side of the coin, while the other side of coin is that state has an obligation to protect life and hence should provide for the protection of the fetus. So these two have to be balanced. So initially MTP Act 1971, first amendment was done in 2021. And mainly the amendment was to provide universal access to reproductive health services to further empower women by providing comprehensive abortion care to all. So why is this needed? According to SDG, goals have to be met, that is reducing maternal mortality rate and also universal access to sexual and reproductive health and rights. So the amendment of 2021 was also the major change in the sustainable developmental goals. So initially the first act was in the Act number 34 of 1971, an act to provide for the termination of certain pregnancies by registered medical practitioners and for matters connected to therewith or incidental thereto. So this is the first amendment, that is new MTP Amendment Act done in 2021. So what are the major changes? There are, as we all know, there will be up to 5 to 6 sections in the law. Some major changes in the section, just I'll be noting it. In the first section, just I mentioned the MTP Act, same 2021, the year was changed. And in the section 2, initially in the definitions, they'll be providing who is a guardian, who is a lunatic, who is a minor. And along with that, in 2021, medical board and termination of pregnancy terms were included. That is the medical board in the clause of subsections 2C, like medical board includes a gynecologist, a radiologist, and a pediatrician, and any other medical officer. And the termination of pregnancy term was also included in the section 2 of the Act. So what is amendment in the section 3? So initially this is the major change in the Act of 2021. That is initially it was up to 12 weeks by single medical practitioner and up to 20 weeks by 2 medical practitioners. But in 2021 it was changed to any pregnancy can be terminated up to 20 weeks by a single medical practitioner and from 20 to 24 weeks in special categories, then 2 registered medical practitioners. So what are the categories we'll be seeing? So the major thing what we have seen in the amendment of 2021 is like pregnancy may be terminated up to 20 weeks by single medical practitioner, and it allows unmarried women. In the 1971, it is mentioned like the married women. Now it is nothing like married. Even unmarried women can also terminate pregnancy. And the single registered medical practitioner 20 weeks and 2 medical practitioners 20 to 24 weeks under special categories. So the upper gestational age limit for special categories is 24 weeks. What are the special categories? Those are like including survivors of rape, victims of incest, and other vulnerable women like differently abled women, minors, among others. These were the categories where 20 to 24 weeks can be considered with 2 medical practitioners. So it is not allowed. Any condition beyond 24 weeks is not allowed, but if at all needed. So if it is because of the rape or any incest after 24 weeks, that should be under writ petition. And if it is any because of the anomaly to the fetus, then it can be done by the taking the medical board permission after 24 weeks. So the other acts like next clauses were same in 71 and 21. And again, the major change we can see the board has been included. That is after 24 weeks. What is the medical board which gives a permission? Like that is having substantial fetal abnormalities. It includes a gynecologist, a pediatrician, a radiologist, or sonologist, and such other number of members as may be notified in the official gazette by the state government or union territory, as the case may be. So the medical board which can give permission beyond 24 weeks if it is not because of rape and the fetus is having substantial anomalies, those include these 4 persons. So again, section 4 is same, that is, it should be done in a place where hospital or any place maintained by the government or a place for time being approved for the purpose. That is like the place which is approved by the government, there only the MTP has to be done. So no registered medical practitioner without having permission can do. And the last thing is the confidentiality has been given most importance in the 2021 Act. That is protection and privacy of the woman. This says that name and other particulars of a woman whose pregnancy has been terminated shall not be revealed except to a person authorized in any law that is currently in force. Like if at all they ask for the details of the patient, we should not give. If there is a letter from the court to reveal the name, then only we should give. And this is a very important thing. And in everywhere where we document in the registers also, we have to give a certain number to that person's name. And we have to document in the same thing, even in the register or in the OP, even in the OP admission also. In the OP register where we enter, we have to enter with the number only, not with the name. So these are the major differences in 71 and 21. Initially, it was to married women, now covers unmarried women. It was up to 20 weeks, two medical practitioners, now up to 24 weeks by 2 medical practitioners. And the confidentiality which was given now, fine along with or imprisonment of 1 year also if the confidentiality is breached. So again, there were certain small changes done in 2024. So those were like the terms where initially the words were mentioned as mental retardation, like in Form E, that is from 20 to 24 weeks, where we give the one clause as mental retardation. The term has been replaced with women with intellectual disability. So everywhere where previously it was mentioned like mental retardation, it has been replaced with women with intellectual disability. So these were the major changes. And just because of these changes, certain changes in the forms, just I would like to go through what MTP forms are available. Right now, we have totally of 8 forms. Form 1, Form 2, Form 3, Form A, B, C, D, E. Form 1 is like registered medical practitioner form, what we have to fill up to 20 weeks. And Form 2 is the monthly statement which we are going to submit to the Chief Medical Officer of the district. That is what number of MTPs done in that month and what are the reasons in which gestation we are doing, that is in the Form 2. And Form 3 is the admission register which we have to maintain, mentioning the number given to that woman, not the name. And Form A, B, C, D are like A is for approval for the place for MTP, which is given by the government, and B is like certificate of approval, and C is for consent, what we are taking. So while doing an MTP, first thing is like we have to take Form C consent, and we have to fill Form 1. And finally, while submitting to the government, we have to fill the Form 2. And Form D is of medical board beyond 24 weeks. Anytime we are applying for any fetal anomaly or any congenital anomaly beyond 24 weeks, that will be given in the Form D. And Form E is from 20 to 24 weeks. So just in brief regarding the forms, in the Form 1, as we all know, we will mention the name of the patient, full address, full name of the pregnant woman, and in the last, they'll be giving the serial number, what number we have allotted to that person who has undergone the MTP. So this number we'll be noting in the registers. So this is the what are the reasons? Save the life of the pregnant woman, prevent grave injury, seriously handicapped, and pregnancy is released by pregnant woman, that is by rape, any failure of contraception. These are the causes in Form 1. So coming to Form 2, what we have to submit to the government by the end of the month is like we'll be mentioning from which state we are from, and the name of the hospital, and the gestational age up to which we are doing, and what is the religions which we have to, and did we counsel the patient regarding the further contraception, what temporary methods or any permanent methods we have to mention. If we have done 3 or 4, after the 3 or 4 women, what methods we have advised them. And the reasons for termination, that is up to 20 weeks, what are the reasons, and beyond 24 weeks, 20 weeks, what are the reasons. So next thing is like the admission register, which we have to maintain. In this, just a few points which we usually don't know. Like here we'll be mentioning the name of the patient also. Normally we have to mention the number, and every time the date of termination of pregnancy is the date of first visit to the hospital. That is when she has come and she has decided for termination of pregnancy, when we have given the drug. And what is the date of discharge? Are we going to write the same date when we have done? Normally, they are mentioning it as like a third visit. So, if she comes for MTP procedure, it's been done. And if it is go with medical management, usually it's like 15th day they're mentioning like the date of the discharge. So these are again the same clauses like up to 20 weeks, what we have to do beyond 20 weeks. So these are all the instructions to fill the register. And coming to the place for the permission by the government, what we have to show. If we have applied for termination of pregnancy up to 12 weeks or be 20 up to 24 weeks, in the category A comes under up to 20 weeks. That is, there should be a gynecological examination table, resuscitation equipment, sterilization equipment, facilities for treatment of shock, and facilities for transportations. Category B, if at all it is beyond 20 weeks, there should be a gynecological surgery operation table should be present and parental fluids and anesthetic equipment. This is just like whoever is applying, and they're very particular of these things whenever they come for any inspection. So this is regarding the first trimester and up to 20 weeks, and up to in the second trimester 20 to 24 weeks. And finally, this certificate is given by the government, and this should be displayed, or whenever they come, this should be shown. So next, this is Form C. If the patient is good enough, she can fill it. And if she is a minor, the guardian has to fill. This is very important, which we have to keep one form with ourselves and one form to the government. So take 2 forms, 2 Aadhars from the patient, and keep one with us and keep one to the government. And that also separately in a separate book, we have to keep it. And finally, this is when the termination of pregnancy beyond 24 weeks. So in these cases, there will be a medical board will be there. They'll be reporting and they'll be giving their opinion on the findings and what investigations has been done. And finally, they'll be mentioning whether she's opinion by Medical Board of Termination of Pregnancy is allowed or denied. So what is the justification for the decision? If they have applied beyond 24 weeks, they have to mention what is the reason for which they are allowing for termination or they are denying. And also they have to mention regarding the even physical fitness of the woman for the termination of pregnancy. And all the 4 members have to write their names. That is the obstetrician, the pediatrician, the radiologist, and the medical officer. And they have to sign. After finally signing this, we can do in a place where MTP is approved. So this is like 20 to 24 weeks. Here only I mentioned like in the amendment of 2021, where the terms like mentally ill women, including mental retardation, that term has been replaced with women with intellectual disability. So even in the forms, they have changed the name of mental retardation to intellectual disability. So these are the new forms of 2024. So so these are the major changes, and we have to know all the forms which are present, and we have to maintain the records well. So implementation of MTP Act in clinical practice is very important. Documentation should be done, and without prescription, there shouldn't be availability of any MTP pills. We should avoid the unsafe abortion, counsel the patient, explain regarding the unsafe abortions, complications, what she can face, and follow the PCPNDT POXO Act. And MTP in the scarred uterus, we should be very cautious, and even in MTP in an unmarried girl. And we all know these all comes under social issues. So every time document is very important. And counseling also. And anything, if there is a violation of the MTP Act, their offenses can be punished with rigorous imprisonment for 2 to 7 years. Any person terminating a pregnancy who is not a registered medical practitioner as under the MTP Act, so it is punishable. And if the place is not approved, it is punishable. Mandatory documentation should be adhered, and confidentiality has to be maintained. So the main thing behind this MTP Act, should be followed is the counseling, documentation, improve the skills of counseling, and know about the Act completely, and update yourself. So various Foxy Focus on MTP and other websites are there for further information. Thank you, ma'am. Thank you from on behalf of Vijayawada Society for giving us this opportunity.
Thank you so
Anita?
much, Dr. Sumanlata. It was indeed a great talk. The insightful talk on recent changes amendment. And one thing I like that mental retardation, you just spoke about intellectual disability. That's I found this term very nice.
Yeah,
And
yeah.
your explanation was in a very practical way, and I hope we all will be benefited. And I just thank you from all of us who are present here. Thanks a lot. It was a great talk.
Yeah, thank you, ma'am. Thank you from all the societies and thank you all the doctors who have attended today. Thank you so much for the opportunity.
Thank you, Dr. Somlata. Somlata, only one point I want to stress is
Yes,
the cases for which we can do from 20 to 24 weeks, that you have mentioned, no, the 6 categories,
yes,
that
ma'am.
has to be tested. People think that for all cases we can do up to 20 to 24 weeks. So
No,
that point has to be stressed. Only the 6 conditions
wait,
that for that one you can do that beyond 20 weeks. Not for the correctable anomalies, you cannot go for beyond
Correct.
20. Yes, ma'am. Wonderful talk, Somlata. Thank you.
Thank you.
So thank you, Dr. Somalata madam, and thank you, Dr. Anita madam. So we'll move on to the second session. It will be a panel discussion on the case scenarios with medical legal problems. So I would like to invite the moderator for the session. Can we have the CVs, please? Dr. Jyoti Banglawala madam. Sahiti, do we have the CVs? Sahiti?
Sahiti,
Priya,
Uh,
no need to just display the same.
Jyoti Banglawala is a
You-
chairperson of our Foxy, active chairperson. And she is having a wonderful law committee in her hand. I don't know what happened to Sahiti.
No problem, ma'am.
She is the chairperson of a medical legal committee. And she has accepted to do this because this program was supposed to be conducted last week. Since I couldn't get any photos, I told her we can do it next week. With kind regards, she accepted to do this. Jyoti Banglawala, welcome.
Yes, thank
Dr. Priya, you can introduce our expert. I
Dr.
don't know, Saj.
Yes, sir. So I think anyone in Tamil Nadu, we will all know that. So whenever we have medical legal problem, we just ask sir only because he is like, we all know that he is part of Manipal University. So I'm like, a proud alumni of Manipal. So we are together. And there, like, sir is like, medical legal expert and like he gives you up-to-date information on whatever you want in that medical legal point. Sir will be the person to be there. So, madam, you want to introduce the panelists or should I just introduce the
No,
panel?
the CV is not there. We ourselves will introduce. If the CV is there, she would have introduced. Yes, I welcome the panelist. The first panelist, our Dr. A.R. Shanti. A.R. Shanti is another one, medical advisor in Chennai. And she is very busy with the medias also. In Pudiya Talamurai, she will be talking so actively. So, welcome, Dr. Shanti. Sorry for the CV is not displayed.
It's okay,
because
ma'am. Can you hear me,
Sahiti is
ma'am? You can
Yeah,
hear me,
yeah,
no,
we
ma'am?
can hear you, ma'am. We can hear you.
Next, I welcome Dr. Srisha. Dr. Srisha is from the Vijayawada Society. Dr. Srisha, welcome.
Hi, ma'am. Good evening, ma'am.
Please, when you go with the talk, introduce yourself because I'm not able to get the CV. Srisha
I'm
is a
Dr.
beautiful
Srisha.
lady. Yes, Srisha.
I'm working as a teaching faculty in Nimra Medical College, and I'm a private practitioner working in an Anu Hospital, Smilavaram. This is a rural setup from NTR district. I'm in a practice since 8 years.
Thank you, ma'am. Thank you. So next we will be calling about Dr. Ashwin Rao. So Dr. Ashwin, I think most of the people in Foxy will be knowing that a very good UV consultant, and he is good in laparoscopy, robotics, and he runs his own hospital and Salem Polyclinic. So anything about that, and you give a new topic with AI and anything, Ashwin will be the person to talk about it. So welcome, Ashwin. And next, madam.
Thank you, ma'am. Thank you.
Thank you. So about the other people, madam. Madam, Sampat, madam, you're muted.
Dr. Kalpana Mehta. Dr. Kalpana Mehta is our other panelist.
Dr. Kalpana Mehta. Yes, Jyoti. Dr. Kalpana Mehta is president of Jodhpur Society. Welcome, Dr. Kalpana Madam. And we have Dr. Suhasini. Suhasini is the registrar of Muthukumaran Medical College. And finally, we have Dr. Leena. She is the assistant professor in Muthukumaran Medical College. Yes, Dr. Jyoti, you can take over.
Thank you, Sampath
Thank you,
madam.
Dr. Priya. We have managed some way about the CVs.
No,
Yes,
madam,
I
it is
don't know,
our own.
Sahiti. I'm not able to find out Sahiti.
No. We all are our own fraternity people and we all are knowing each other. So there is no need to display the CV. I'm so thankful for you for giving me opportunity in the Pinnacle series number 16. And so happy to see all the people from Bareilly, Raulkela, Jodhpur, and Vijayawada. So today you have given me the topic, the medical legal issues in the OB/GYN. There are so many issues, but most of the time we are just concentrating on the consent documentation and counseling, because everything starts with when the wrong type of or below quality counseling or consent has been taken, and then only the doctor is getting the problems. Most of the time, when everything is so good, so well taken consent, well done documentation, well done counseling, so even the mortality is there, still the doctor is skipped from the litigation. But when we are failing in the consent documentation and counseling, there are more chances of the litigations. So we are just concentrating on the consent and documentation part today. And I'm so happy to see Dr. Vivek Madi. I have seen him just conducting a medical legal panel in Salem, and so happy that he is expert. So sir, whenever I will just go out of track, just please correct. So you're so expert in all these things. So thank you very much for being there. So I'm sharing my presentation.
Ma'am, will you be introducing the panelists?
Yeah,
Yes,
actually, we
Sahiti,
were
everything introduced.
calling you, but we introduced without CVs, Sahiti.
Okay,
somehow.
okay.
So we'll go
You
ahead with
allow
the
Jyoti to
panel.
project.
Yeah, if you have Jyoti Madam CV, can you just display?
No,
Sure,
no.
ma'am.
Priya, my screen is visible or
Yes,
not?
ma'am. Yes.
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 So
Yes.
I'm not doing the full screen, because there is actually we are having a lot of rains here, and we are just running short of electricity and everything. And just I requested, just now I requested Dr. Ashwin ki if anything happens, he has to take care of the this panel, because
Should you
Dr.
want to
Ashwin.
give the slides to Sahiti for
No,
her to
Ashwin is
display?
also having the slides, because when I made the slides previously also, Dr. Ashwin Rao helped me in these slides. So
Okay.
we are just going with this medical legal issues in the practice.
Jyoti, if you
And
want, you can close the video. Then you will have some, if you want.
yes,
If there is no electricity, what telling, no further time telling. If there is any disturbance, you can close the video and the audio will be clear.
yes, madam. Whenever
Okay, now it is clear only. You proceed.
Yes.
Mm.
So I welcome all the people, Dr. Kalpana Mehta, Ashwin Rao, Dr. A.R. Shanti, Dr. B. Shirisha, Dr. Suhasini Karnal, and Dr. Leena Dhruv. And we have to just see that why this medical legal issues in the practice are coming. The slides are moving or not?
Actually, slides are not moving, madam.
Now?
Yes, now I can see. Yes, ma'am.
Yes, ma'am. It's moving.
So we can just see that every time that there are so many attacks on the doctors, there are so many medical legal cases, and ours is the branch. The OB/GYN is the branch where most of the litigation we are facing. More than 80% litigations are in the surgical branch. We all are seeing this. And what is the definition of the medical negligence? We all are knowing. It is not like that super specialty hospital is the just quality care is there only. When we are saying medical negligence, we have to just see what the ordinary practice is. What the PHC or CHC doctor is doing. We have not to see that what the Apollo hospital is doing, or what the Bombay hospital is doing, or what the corporate hospital with the big multi-specialty hospitals they are doing. We have to just see even in the area we are practicing, what the current practice is, what the ordinary practice going on in our area, and what the basic management the doctor can give. If we fail to do such things, then only we can label this as a medical negligence. And we can just see the medical negligence is of the three types: criminal, civil, and contributory. Everybody knows about this. And this medical means every doctor, every gynecologist, one or two in her lifetime, they just felt this, that people coming to their OPD, they are just blaming them. It is not like that ki everybody has to go to court or police station or just face the violence, but the gesture of the uh, attendance, gesture of the patient, many times they just make doctor guilty that they have done something wrong. So first we have to just see what the common doctor has to do. They have to do just counseling, consent, and documentation. So any one of the panelists, can you just tell about what is the consent? Any type of definition. It is not like some fixed format, but what you understand by the consent. Any one of you can just tell me.
Yeah, consent means if for a common cause and with the same reason, the same sense, two persons agrees to do that.
Okay. So actually it is the voluntarily agreement, and this is just a contract between the patient and a doctor. So there are so many types of consent. Anyone can just tell about the so many types of consent there is? There is the implied consent. When the patient is coming to your chamber, it is implied that he or she is coming to your chamber for examination or for treatment. So there is no need to take consent ki I am going to you, I am going to so and so doctor for consultation. There is no such consent. This is called as the implied consent. And then there is a express consent when there a verbal or written consent for the act, for the treatment. So the express written consent is mandatory for all invasive procedure and all the procedure, but not, but if the doctor is, if you are doing the gynec practice and you are a male doctor, like Ashwin, Dr. Vivek. So you have to take a verbal consent also before examination of the female patient. But if you are female and the patient is also female, then we can just say this is the implied consent for the examination. But the male doctor is examining, he or she, he has to just tell the patient that I am going to examine you, I am going to palpate your abdomen, I am going to just do the vaginal examination. So there are so many types of consent, and actually this is the first step of prevention all the medical legal complications. So we are going for the first case. The first case is as Mrs. AB, 40 years, para 2, was admitted with irregular and heavy menstrual bleeding and not responding to conservative management. She was hypertensive, hypothyroid, and history of diabetes is there. And the diabetes is not controlled with medications. Her uterus was bulky on examination, fornix is clear and cervix normal. USG and TVS suggest uterus bulky with adenomyosis with 12 millimeter endometrial thickness, and adnexus are normal. All other investigations are normal, and she was in conservative management for approximately 1.5 years. Patient and party was asked to write and sign a consent form as conservative management failed, so her uterus need to be removed and risks are involved as she is diabetic, hypertensive, and hypothyroid. So TAH with BSO done, and patient suffered from severe hot flushes and sued the doctor. Why her ovaries were removed. So do you think that that particular consent was the proper consent? And if you are feeling that the consent is not proper, then what type of consent should we take?
We have to take procedure specific consent. We have to write the name of the procedure and nature of the procedure. What is the mode of treatment suggested, and what is the implication if we don't do that treatment, and then adverse effect alternate procedures, and all possible complications should be explained. Common complications should be explained in detail, but rare complications also should be in the writing form. In that, we have to write the need for hot flashes and hormone replacement also in that.
Okay. So actually this particular type of consent was not the proper consent. It was the vague consent, which is
Yeah.
having no value because we have written everything in the vague language. So actually we have to take the full consent, even about the anesthesia, even about the procedure. If we are failing in the procedure, that this procedure is, we are doing to do vaginal and we have to then underwent do the
Root.
abdominal procedure, we have to write everything, the route of the operation, we have to write about the complication of the operations, and even the side effects we have to tell verbally, or even we have to write this. So this actually, our motto is not to just scare the patient. The patient should not be fearful about just read and listen all the consent
Yeah.
papers, but we have to just tell him or her that this may happen, and if it may happen, that what we will do. So another case is the Jaipal Reddy versus Rao, MD Yashodhara Group of Hospitals on 20th September 2013. This is the National Consumer Dispute Redressal Consumer Complaint number 54 of 2013, where hysterectomy with BSO done in the case of adenomyosis with endometriosis and signatures taken on a blank paper. the compensation of 10 lakhs along with the interest of 9% from date of OT. So we feel necessary to discuss what is valid consent. This particular case where we just about after this case, the consent part was taken care, and every doctor, even every surgical, not only the gynecologist, they just give the stress upon the taking consent properly. Then another was the Vinod Khanna versus RG Stone Hospital, where after de-roofing prosthetic abscess, rectovesical fistula developed in a patient of HIV and cryptococcal meningitis, and Kaposi's sarcoma, Cox advised recatheterization and the 6 weeks. And then it did not turn for follow-up and consent, not though the patient was and the attendance was at the fault, but the signatures were unfair and deceptive. So, so the compensation of 10 lakhs awarded. So every time the consent should be procedure specific. So anyone can tell me how to take informed consent in operative procedures. Just as a gynecologist, how to take operative procedure consent for the operative procedure like cesarean section or hysterectomies.
So, good evening, ma'am.
Leena, just Leena.
So, for the informed consent for any operative procedure, first we should tell the patient for what indication we are going. Like for LSCS, what indication is there for cesarean section, what complications can occur in it, how many days the patient need to get admitted, what kind of an anesthesia should be given to the patient or can be given, the complications, any side injuries which can occur. So all those things should be explained to the patient in the consent form. And the patient should be, the patient should sign the consent form along with any relative signature should also be there along with date and time in the consent. So that and all should be explained.
Yes. And in the case of Vivek sir, you want to say something?
Yeah. See, I want you to tell about the famous case of Samira Kohli versus Prabha Manchal.
We are coming to that case only.
Yeah, so that case is very important because that speaks about specific consent. Here, the Supreme Court observed that there may be more than one way to treat endometriosis. But one doctor might view conservative treatment with hysterectomy as a last resort, while the other would say as an immediate cure. But whatever the reasons are, what could be holding that it is a case of a doctor acting in excess of consent, but in good faith. Yeah. So the main thing is the doctor should explain everything to the patient before doing the surgery, what they are going to do, and doing surgery, only do what they have explained to the patient. He must not say, okay, this might be good for the patient, so therefore I will take consent later and go and do the surgery. That's not right. Be very specific and only do that part of surgery. It's okay, even if you have to come out and do the surgery another day, that's all right. But don't try to think, oh, I'm going to save money for the patient and therefore I would like to do a particular surgery and finish it off at that point of time. And later I will do the explaining to the patient. No, it will never happen. That patient wants to know what they're going to have, what surgery they're going to have, much before they go ahead and do the surgery. Today, we should consider our patients as adults and capable of making decisions for themselves. No paternalistic view is accepted in today's practice. So please always take consent before doing any procedure.
Yes, like this, we have to just give the diagnosis. Give the diagnosis to the patient and the alternative therapies also we have to just give. So just like
if you're not sure of the diagnosis, better not to do the surgery.
Yeah, better not to do the surgery. And we have to tell the route of the surgery, and the change of the route we have to just tell beforehand. If we are seeing that we can get difficulty in the vaginal hysterectomy, pre-op we have to tell the patient and the attendants when we will getting the difficulty, we will change the route of the surgery. It is not like that patient is lying on the operation table and on the table we are deciding to change the route of the surgery. And that's the reason previously when we were student, that time there was the trend of doing tubectomy at the time of cesarean section. We all used to do the tubectomy, but whenever there is some case of septicemia or suture are going on, anything happens, it is coming on tubectomy. So the government just emphasize the fact that their family control program, the family planning control program is going down just because of these two, three reasons. So everybody was avoiding that, particularly whenever we are doing cesarean section, just avoid doing tubectomy. When after 1.5 months, after 3 months, after 4 months, we can anytime do tubectomy. But we are avoiding the complementary surgeries. We have to just avoid if we are seeing some difficulties. So this is the actually how to take the informed consent. Anybody can just elaborate this thing. Shanti madam.
Yeah. So we are well, especially I just want to say one point. Both in the government and private setup, in a lot of the consent, we don't see the signature of the doctor. Most of the time, it is we are just telling the staff nurse get the consent signature and we don't sign it. So it is always better. Most importantly, otherwise it is becoming invalid.
Yes.
And so the doctor should sign, and also the two witnesses who are unrelated. So most if actually if the staff nurse of that particular place, no, they will say that always the staff nurse of that institution will support the institution like that. So better select a person who is not related neither to the hospital nor to the patient. And as you rightly mentioned, we have to mention about the route, and the possibility of changing the route should also be done before itself. And then when you explain the complications, what normally we see, we have to say that this is all the commonly we see the complication. There are few complications which rarely occurs, but we have got the expertise. We have seen such complications. We are able to tackle like that. Some empathetical, convincing statement should be there. Always to be on the safer side, say that this may happen, that may happen, you may die. All these things, so that the patient will run away. At the same time, we have to use the word in a proper manner, in a convincing manner, but explaining the things in a proper. So we need to have that soft skill and communication skill in explaining the each and every aspect. Procedure specific consent should be obtained, or not a blanket consent for every procedure.
Anyone can just tell.
Hi, madam.
Can I just
There is
add
a
one word
consent
about
called presumed
uh,
consent.
Yes,
can I
Applies in
just add a
emergency
word?
situation after the PPH to go for the peripartum hysterectomy. Applies in emergency situation when the patient
yes,
is unable to
when there
give.
is a life-threatening situation, that time it is actually rare possibility. But that time we can take consent from the attendants. This is the life-saving procedure.
Yes.
And one thing I just want to ask Dr. Vivek Madi about this
Yeah.
video consenting, video recording consent, because this video recording consent is a double-edged sword. Just please, sir, just say a few lines about the video recording consent.
Before we go to video recording consent, I would like to just say a word about witnesses. The witness signature. Uh, it is always better to take a witness who will be available later in the court, because the purpose of witness is to say that is the signature of the doctor. Why you're calling a witness is, yes, that witness will say, yes, this is a doctor's signature. Or otherwise, people say you would have forged the signature, the doctor was not available, so it is some other person's signature. So witness is somebody who should be able to come to the hospital or to the court when required. So that's important. Then when I talk about video consent, yes, today video consent is acceptable in the courts. Therefore, it is always better you have a video consent recordings kept carefully, and also you record the every from what time to what time, and also mention that you have taken video consent.
Yes, sir.
In the
And
paper.
actually, most of the time, at our India, there is the common scenario when girls are going to their maternal home for their deliveries, or just they are shunting between their husband's home to maternal home. So many a times their husband is not available, and the parents are not agree to give the consent for cesarean section, and they are just saying ask in-laws. So at that particular moment, we can just take the video recording consent from the 2, 3 family members when there is a conflict about giving the consent for any surgical procedure. Many a times the girls are coming with their parents, and then parents are saying we cannot give consent, just in-laws can give the consent. So we have to just keep in the mind all the social aspect of our Indian society, and that particular time we can just take the video recording consent, and just as sir said, we have to mention this on paper that this particular person is not available. So we have taken the video recording consent. We are having beautiful Foxy uniform consent forms available on the Foxy website, where they are saying each and every procedure should have, means every procedure we have to take the independent consent, and this consent form should be filled properly. So now we are going for this landmark case. This is the actually Mrs. Chandok versus Sri Gangaram Hospital on 9th July 2007. The patient is of DUB with 2 previous LSCS, and she underwent for total abdominal hysterectomy under GA. On 21st June, patient was given LEA and DNC done. On table, decided to do vaginal hysterectomy, laparotomy because of bleeding from ovarian stump, and she then needed nephrectomy. Bleeding, so judgment came, and that actually it was the 5 lakhs compensation awarded. What are the just flaws you can just see? Bleeding is not the negligence from the doctor's side, but the deviation from the route, it was not acceptable unless it was the life-saving. And hysterectomy route was not told to the patient. Even the nephrectomy done, even the bleeding was there. So many bottles of blood components again. These all are not negligency. Negligency is that patient is not aware about the route. The on the table decision of changing the route was there. So every time we have to just tell our patient about the route. If there is any deviation, we have to just tell beforehand. So the blanket consent is not necessary, but we have to tell our patient, I am going to do vaginal hysterectomy. But if I am unable to do anything like this, and it can happen to do just, we can go for abdominal if vaginal is failed. Sometimes we are doing the laparoscopic hysterectomy. Then also we have to tell that we have to just, we may need to open the abdomen. This is the thing. This is Samira Kohli versus Prabha Manchanda case. Dr. Vivek Madi just said. I am just taking it in a very short. Unmarried lady of 44 years. She came with a bleeding complaint, PV for 9 days. On USG, fibroid uterus, right ovarian chocolate cyst, small cyst on left side. Consent taken for diagnostic laparoscopy under GA for affirmative diagnosis. Laparotomy may be needed, no mention for hysterectomy or alternative procedure. Only they have taken consent for laparotomy may be needed. On when the TAH with BSO done, assistant took consent from her old mother while the patient was under anesthesia for the hysterectomy. Patient's boyfriend lodged complaint of negligence for unauthorized removal of reproductive organs as she is suffering from premature menopause with diminished matrimonial prospects. National Commission held as patient voluntarily visit the clinic and consented for diagnostic and operative procedure. And patient was 44 years. Hysterectomy was done for grade 4 endometriosis, which may damage other organs. So expert opinion was taken from Dr. Sudha Salan and the case was dismissed. This aggrieved patient party appealed in the Supreme Court in the 2004. Then the compensation demanded 25 lakhs in that time, and that instigated by her own boyfriend. And then compensation awarded was 25,000 plus bill if paid and 5,000 rupees cost. So all of you know, many times we land in the such cases, or you means just agree that can the doctor be held negligent for taking decision of hysterectomy on the table? Just like Shirisha was telling, if there is a PPH and we are going to just do the hysterectomy on this patient. So can you just think that the doctor be held negligent for taking decision of hysterectomy on the table?
For this
Won't be held,
Sudha,
we
Shanti?
cannot be held negligent, but then we have to explain before proceeding that getting the consent prior itself, because we know it is a case of endometriosis, so she might land up in hysterectomy. So we have to get a prior consent saying that this patient, though posted for diagnostic purpose, still she might need laparotomy. So that consent should be got prior itself, ma'am. That
Okay.
is one thing here.
Actually, the consent was for the diagnostic laparoscopy, and laparotomy may
Yes,
be
ma'am.
needed only was the needed. And this was the
Yes.
life-saving
Can,
procedure
yeah.
actually. Yes, Vivek.
But
What
can I
was-
just add here? The Supreme Court has clearly said that the patient was neither mentally challenged or incapacitated. There was no medical emergency during the surgery. She was only temporarily unconscious. Gynecologist also waited until the patient regained consciousness, discussed the results of the laparoscopic examination, and taken a consent for removal of uterus and ovaries.
Yes, sir.
In the absence of emergency, the question of taking the mother's consent for radical surgery did not arise. This was the Supreme Court decision. So here, there was no emergency. And only during an emergency, you can to say, and you have to show that you have done a procedure to save the life of the patient. Only if that situation occurs when you have to remove a person's organs to save her life, only then you can do it without the consent. Otherwise, at all times, removal of any organ in a person, you can't do without the consent of the patient. That should be taken as a dictum. Please don't remove any organ. Even appendix, you may think it is of no value. No, you can't remove it unless you've taken consent from the patient.
Yes, sir. Actually, the boyfriend actually argued such things that they are going to marry just within the 6 months, and the boyfriend was saying that they just want, if their ovary is removed, tubes are removed, they just want to go
They
for
can have a baby.
IVF.
Yeah.
IVF.
Yeah.
So when we removed her uterus, how can they go for the IVF? So
Yes.
we have not to miss, not any time we can do the additional therapeutic procedure without asking the adult patient. This
Yes.
is actually take home message. So the learnings are there should not be, can there be a common consent for diagnostic and operative procedure where they are contemplated? Yes, anytime. Can there be a common consent for particular surgical procedure and addition of further procedure that may be necessary during the course of surgery? Yes. And can consent be taken by the assistant doctors? Because many a times the chief surgeon is doing the surgery. So there is many a times our doctors are asking, is the consent taken by the assistant doctors? Yes, the consent can be taken by the assistant doctors. And if there is no consent given person available, what about the emergency life-saving cases? Dr. Ashwin Rao, since so long you are just keeping quiet, Ashwin.
In a life-saving procedure, consent is actually not required in case you can prove that it's being done to save a life. This consent can be taken even post-procedure also. That's what the code says. And in case you're unable to obtain it also, if you can justify that the particular case you had to handle because of an emergency, you won't be taken to task by the court even if something goes wrong. In fact, you can prove that it was done for patient's goodwill.
Yes. So this is a landmark case where the patient, this T.T. Thomas versus Eliza in 1974, it is actually diagnosed as a case of perforated appendix with peritonitis, and unfortunately no operation was done until his death on March 13, 1974. So in any emergency cases, court delivered a verdict in favor of the plaintiff, stating that consent under such an emergency life-saving cases is not mandatory if the patient is not in a proper state of mind to give or not to give a conscious answer regarding the consent. That time doctor is totally free to do operative procedure or free to take any decision to save the life of a patient. If he is in a fit condition to give a voluntary answer, the surgeon has a duty to inform him of the dangers and risk involved in the deferring the operation doing without an operation at the earliest time. Many times we have to just obligated to do good for our patient. If patient is not in the condition to give consent, if patient is not having any attendance, and if we are seeing that many times road traffic accidents happen, doctor has to do the procedure for the saving of the life of the patient. So we are coming to the case number 2, where Mrs. DB, 36 years, para 0+0, admitted at 5 a.m. with severe PET in labor with meconium stained liquor, had not engaged, and FHR are irregular. CTG decelerations are there. Advise LSCS at 6:30 a.m. for fetal distress. Consent was given at 9 a.m. as the husband was not available to take decision. LSCS done at 9:30 a.m. Baby delivered depressed, cried a few minutes later after birth, later diagnosed decreased IQ, and then patient sent a legal notice to the doctor. So you are seeing where the loopholes are there. So if you are the doctor, the what decision you have been taken.
See, it is enough to get the patient signature. That is, the patient is only, we are operating on the body of the patient, and it is fetal distress is an emergency. So patient signature is sufficient, and we should have done it.
So actually, many a times we are taking the expert opinions from the another obstetrician, and this actually our committee or our this medical legal committee in the states or the national level, we are just inducting all our gynec friends also. You just see the situation of the our fellow gynecologist, in what situation she is working. Many a times patients are getting admitted in the hospital only and still they are not giving consent. Many a times the doctor is going again and again, just please give consent, your baby is dying, baby is dying. But the attendants are still in the hospital, in the labor room, and not giving the consent. So if any such case for the expert opinion coming to you, you have to just consider our own obstetrician as that she is at not fault. But you have to write again and again on our own paper, hospital papers, our patient history paper sheets, that the patient is not giving consent, and you have to take sign of any,
Refusal signature, refusal
yes,
to consent.
refusal signature from the attendants. Many a times the attendants are not giving the refusal signature, so you have to take signature from two nearby, if you are having staff or another any another patient lying on the another the ward or something like that. So
Can I add one thing, ma'am?
yes.
Ma'am, in this case, a video recording is perfectly acceptable by court. The court says it's okay to record because a negative consent or a denial to give a consent can also be held valuable in court as well. So here it can really help is what I feel.
I just want to say one just practical tip. What I used to say when they are not willing to give consent or refusal consent, I used to say this is our hospital policy that we will not treat we cannot keep on seeing what is happening to you, the complication, and see it at death, and that is not our hospital policy. You better go to another hospital where your treatment is accepted, like that. We used to convince, and then immediately they will sign either the consent or the refusal. Of course, it may not work for everybody. This is just some way of talking, so that we also have got the right. We cannot simply see somebody is dying and later the same thing can go against us. How do we know? We are non-medical persons. We didn't know the seriousness. We didn't know that bad. It will go like that. So it was not communicated properly that the baby will die. All these things can happen. So like it is just typical. It is like it goes like a luck only, depending upon the person. But we also have to use some kind of tactics while talking to the patient.
There are a few points you all means you all are actually covered all the points that consent for refusal we have to take, and meanwhile what treatment we are giving to that patient. The patient is refusing for the cesarean section, but meanwhile if we are giving her ringer or any antibiotic or anything, we have to just write down with the treatment part. We have to be that should be covered properly. It is not like that a patient is lying all alone in the labor room. And there are few points. If the refusal consent is there for emergency treatment, we have always asked for help from our colleagues, preferably senior colleague for a second opinion, and also to convince the party. Sometimes if the patient is seeing that the another gynecologist is coming and saying the same thing, and the senior gynecologist is coming and saying the same thing, many a times they are convinced. If in a hospital, administration must be informed in written. Information to the inspector of the local police station in writing is essential in private practice. Otherwise, if the patient lodges complaint or if baby dies and some violence happens, then the doctor is under the any violence or any threatening or any local police station, anything can happen. So we have to just give a help call to the local police station also. And local ops and gynae society and government health services should also be informed. Nowadays, every society is having east, west, north, south wings for this helpline numbers. We all are having. We are just in local Obsgynae society. We had made so many actually helpline. There are groups we have made. Even our own city, we are having 5 groups in the different vicinity. If something happens, just we have to put a message in our particular area group that I am in the problem. Please do come for help. At least 2 or 3 or 4 gynecologists reaches on the spot. So these are the emergency. Actually, we can just can take help. So now that this is the Madam Sampath, madam, is there any time left for the Shanti ma'am?
Yeah.
Yes, Jyoti, you can continue. You can
Okay.
continue.
Okay. So this particular case, NIMS
20
versus
minutes more.
Prashant Dhanaka, and it is in the 1999. The patient, 20 years age, an engineering student, filed a complaint for medical negligence on the part of doctor on becoming wheelchair bound after spinal surgery. This is not the OBGYN case, but this is just to show that the compensation can awarded in the 1999. They awarded 15 lakhs of compensation just because every time they are awarding compensation for medical negligence, it is just for most of the time court. They are not doctors. The jury is not doctor. Judges are not doctors. The lawyers are not doctor. Whenever just they can just lodge a complaint. Everybody is saying doctors are earning so much, they are enjoying life, they are doing this and that. So we have to be very, very aware about the things what we have to write, what we have to tell, what type of counseling we have to do. It is, we have taken the case of the spinal surgery, but same when we are doing cesarean section. If we are seeing that we have to do the cesarean section, why to give a lot of trial when we are seeing that this will land in the cesarean section? Prior hand, we have to tell the patient that your patient is not, patient's attended, your patient is not going to deliver normally. You have to go for the LSCS. If patient is refused, if the attendants are refusing, we have to straight away telling them all the complication that can occur during the normal delivery. Otherwise, if they are having the child, which is with the diminished IQ level, they can sue you for the whole up to 21 years of the life of that child for all the things the child has to, means all the treatment part, all the livelihood, means earning part, everything you are suffering for that. So the Supreme Court guidelines are that medical negligence in error or misjudgment in medical treatments are not similar. If standard care present, it is not a medical negligence. Sympathy for the victim should not be blindside the court in awarding compensation. Compensation should be reasonable to provide means for survival of the victims. So now,
Can I just add one more? The
yes,
record compensation for medical negligence is 11 crores. This Dr. Kunal Saha was the Ambry Hospitals,
yes,
Calcutta.
yes.
So that's how serious the consumer court takes cases too. So it can be sued. So very important is doctors should take medical indemnity to protect themselves, insurance,
Yes.
so from financial problems. So and also another thing is so has CCTVs in their hospitals and consultation rooms. So that record any all violences that's taking place.
So that Kunal Saha case is the highest awarded
Yes.
compensation in the case in the Indian history.
Madam,
So
can I get two clarification with reference to the language of the consent, whether it should be always in the local language and whether it is printed form or written form? That confusion is always going. Let us just clarify in this panel.
Yeah, it's mainly the patient should understand what you're telling. That's the thing. In the end of the day, if the patient says, I have not understood anything, and this language of consent is not the language I speak, that's it. It will go against you. So if it is a Hindi patient and you have taken a local language, regional language, and the patient says, I don't understand anything of the consent, then you go against them. So it's important that you take a consent in the language the patient understands.
So it is very difficult actually being in Chennai, the place of medical tourism. The language patients are coming here. How can we translate all these things? It's difficult, sir. I think it is.
That's why there's a Google translator. Just put it up in the translator, translate and give it, and then take a printout
The
and
same
ask
thing I
them
want to
to
add
sign.
here. In case what you can do is even Foxy consents if you have it in a Word format, you can put it on Chat GPT. AI converts it to the language of your choice. That can
here
also be
the
done.
AI boy is saying this.
To be on the safer side, we can say that we can put that responsibility to the patient also. See, this is the English format which Foxy has given a very proper manner, and there may be a problem with the Chat GPT, the translation, all these things, whatever it may be. Why we have to take all the headache of
No,
translating?
madam, we have to take some headache because afterwards it will be big headache for us all.
Okay, yeah, I understand. But taking the
Ma'am,
small headache is
ma'am, the other
better.
option.
Yes.
Printed
Ma'am, the
form.
other option is since you're communicating with the patient, even here also, if the patient is able to understand your communication way of your way how you're communicating and able to reply to what you're asking, then a video consent also is acceptable here. So as long if the patient doesn't understand you at all, then the problem comes in.
Yeah, I thought. Yeah,
Yes.
nice.
Actually, and Dr. Somlata has taken this MTP part so well, and Dr. Sampath Kumari madam was asking about the 22 weeks gestation and 20 years. So I have just take this MTP case in my PPT. This Mrs. AD, she's primary gravida at 28 weeks gestation, has come to OPD for MTP, confirmed by USG that 28 weeks fetus with fetal echo with gross congenital anomalies and hypoplastic left heart syndrome is there. So what step you will follow? Anybody can take this.
So it is about 28 weeks. So we have to approach the medical board to say that this is not viable pregnancy with the baby is having a non-correctable anomaly. So the board has to decide according to the board's direction. We can terminate.
Yes, madam, the most important thing we have to do, though this patient, I have not mentioned the age of the patient, but every time we have to just take the ID proof for the age of the patient. Many a times when this age of adult to adolescent, many a times we cannot just remark the 17, 18 years girl that if she is saying she is 20 years, we have to just take the Aadhaar card or any driving license or anything. But many a times the 17 years old girls, 16 years old girls, they are coming with the ID proof of their sisters or anything. So first thing we have to do, always ask for the ID proof, then the counseling, what can happen, and then the just medical board you have to just said. So the composition of the medical board, Somlata already told us, the gynecologist, pediatrician, and radiologist. And the power of medical board you all know. So this is the actually one case in 2023. Just to give birth to an unwanted child or not is the question posed by the appellant in this appeal and being unsuccessful before the Gujarat High Court. So FIR lodged on 2023 against the person who is accused under section 376 of the IPC for having sexual intercourse on the false pretext of the marriage, and she realized that she was pregnant and was about 25 weeks. So that time in 2023, 25 weeks pregnancy when she is going to terminate, she doesn't want to terminate the pregnancy. Under Article 226 of the Constitution of India and Section 3 of the MTP Act 1971, seeking to terminate her pregnancy considering the grave injury that could result to her physical and mental health. She went to the doctor for termination of the pregnancy. Her parents went to the doctor. The patient herself is not actually in favor of termination of the pregnancy because she was thinking that boy will marry her. But when the boy refused, by that time the pregnancy was 25 weeks. So that every you can just see the on 19th August 2023, the medical board reported this USG is of 27 weeks, 2 days plus minus 2 weeks duration. And weight of the fetus was around 1 kg with no congenital anomalies. We all are knowing when we are delivering 27 weeks fetus, most of the time it survives. So there is no indication for termination of pregnancy as per the maternal physical health, but as the survivor is giving the history of sexual assault, continuation of this pregnancy can affect her mental health. We are knowing in India it is next to impossible to give birth in the unmarried state for the rape victim and just to raise this child. So she wants MTP. So permission of Honorable Court was required. On 28th August, the Supreme Court granted the permission for MTP within next days. And if fetus is alive, the hospital shall give all necessary medical assistance, including incubation either in that hospital or any other hospital. State shall take step for ensuring that the child could be adopted in accordance within the laws. Requested the concerned doctors for DNA test report by drawing tissues from the fetus in order to use it as a piece of evidence of the for next trials. So how the consent for the MTP now should be taken, because many a times for MTP the girls are coming. The new MTP amendment is there, And the new amended act is saying that there is no necessity of married woman to be written in the consent form. Unmarried woman more than 18 years of age can go for the MTP. So what sort of precaution we all have to take for the MTP consent?
This patient, what is the age of the person, ma'am?
Hmm.
Age of the person is less than 18?
This particular is the sexual assault survivor, less than, it is above
No,
18.
age doesn't matter. Yeah, it is a rape, case of rape. That is the reason.
No,
The
no,
case of
sir.
rape and
No, the
uh,
age matters a lot in both acts.
no, under
POXO Act
18
and
is POXO. It comes under 18, it's under POXO. But even if it's adult, if she says it's a rape, then it becomes a criminal act.
Sir, there is a, Shanti madam, there is a bit difference. If she is saying it is a rape, then age doesn't matter. But if the patient is coming for MTP and we just find that she is below 18 years, then we have to just go for the POXO. We have to just lodge a complaint in the POXO Act in our own settlements, near vicinity. So in this case, Form C and Form 1, both surgical and medical abortion about up to 20 weeks. Form always, this is the up to 20 weeks. Form E for more than 20 weeks. And Form D report of medical board beyond 24 weeks. We all are knowing. But if we are just getting such patients, we have to just preserve a tissue for DNA testing, because near future, if we have to go for the court for any, if the court is asking us to come to the court, we should know that we have sent the tissues for the DNA testing. This we should always take. We have to take consent if the girl is adult, more than 18 years age, and she is coming to you just for the 9 weeks, 10 weeks, 11 weeks. Many a times gynecologists are taking consent on their own hospital papers, that in near future she will not drag the gynecologist if she lodges a complaint against her. Means this is the many times we are taking consent from the unmarried girls, that this is on the mutual consent. It is a near future she will not lodge a complaint against whoever is the uh, means pregnant, who is the father of this fetus, because afterward, if we are just 9 weeks pregnancy is there, we are just doing curate, we are not sending the tissue for the DNA testing, because we are seeing the girl is 21 years old or 22 years. But after 3, 4, 5 months, this girl can lodge a complaint against her boyfriend when boyfriend denies the marriage. So every time we have to take consent from the girl on the paper also, in our hospital paper also, that this is the consensual act she is doing. It is her consent for doing, getting this MTP done. And this actually, what is your take, Vivek sir? Because most of the
Yes,
time we are.
correct. I agree. It's important because for rape, you need to give the court evidence of the DNC specimen. So it matches with the accused. So therefore, you are helping the court in getting justice for the rape victim. So that is very important. So in any adult unmarried girls, rape is you should keep in mind and take consent. Was it consensual sex or unconsensual sex? That's important.
No,
If
this
she says if it's consensual, it's okay. If she says it's non-consensual sex, please, your duty to keep the specimen in saline water.
So actually,
And
we have to
then,
just write that this is due to the consensual sexual activity, and I just want to get the termination due to failure of contraception or whatever the logic you can give. But we have to take a sign from the patient on our uh, papers. So this is the second number. The case number 5 is an unmarried woman, unmarried girl of age 14 years, come with the 22 weeks of pregnancy for MTP. So, in which category you are taking this girl? 14 years old girl is coming to your clinic, and who should sign the consent form and what important notice to be made?
Comes
It's
under
less than 18 years, so it will come under POXO Act, ma'am. So we have to file an FIR and give police notification. Then she's 22 weeks, so 20 to 24 weeks. You can get the consent from 2 registered medical practitioners, and This comes under rape or consensual, we have to find out, ma'am. It's not
No, for
mentioned
14
here.
years, POXO means there's
So
no
below 18 years, everything is
Uh,
rape.
yeah, everything is okay. So this is 22 to 24 weeks. So we have to get consent from two registered medical practitioners, ma'am. And the consent should be signed from, because she's less than 18 years, consent should be signed from the guardian also. And the FIR should be filed, ma'am.
Okay, so we have to register application in the POXO, but
Yes.
you do not need to wait to just policeman come to your clinic. You are just have to inform the police station.
Inform, intimation alone.
Yes,
Yeah.
just inform and proceed with the treatment part.
Termination.
But for the safety purposes and for the POXO Act purposes, you have to just preserve the fetus part for the DNA example. And you have
DNA
to
analysis.
hand over this fetus DNA to the policeman. Even if the patient are saying that they are not agree to just give the DNA thing, you have to do this procedure totally. Because after 2, 3, 4 years, they can come that my 14 years old girl came to you for MTP and you have not preserved the DNA sample. So you have to do all the things which are written in the POXO Act. So these are the rules under the MTP, which Somlata has already told me. So this is the same case, 17 years old sexual assault victim. This is actually, if the girl is less than 12 years, that time also more than 12 years, she can give the consent for treatment. Many a times when they are many a times the girls are coming with the guardian, no parents are there. So you can just examine any patient above the 12 years of the age with the consent of the patient. And at that particular time, the policeman, many a times this beggars, roadside beggars, these girls, this kachra binne wali girls, many times these girls are coming, they are not having any guardian, they are not having any parents. And these girls are coming, even the policemen are coming with the girls, madam, we found this girl in the road bleeding, and we see this girl is 18 weeks pregnant or 16 weeks pregnant. That time, in the benefit of the patient, the fellow doctors, your institution, your hospital in charge, even the policeman, any child helpline officers, they can be guardian and they can give the consent.
You have to inform the CWC,
Yes.
Child Welfare Committee. They take responsibility for these people who have no parents or guardians.
Yes. So we have to be just see that below 12 years, we have to just see for the guardian. And if the girl is mentally challenged or not, or if we are seeing anything, the parents or guardian not present. So any doctor, senior administrative officer and CWC member, as Vivek Mati sir said, and we have to always assess the age assessment should be there. If the girl is not having any Aadhaar card, many times the roadside girls, they are not having any Aadhaar card, they are not having any school leaving certificate, driving license. So we have to assess the age by the physical development and dentition. And if we are not able to do, then radiological assessment should be done. Because it is not, we are in India, most of our population living in the rural area, tribal area, these girls are not having, many times they are not having Aadhaar cards or driving license, or if they are not going to school, they are not having school leaving certificates also. So this type of things we can go for the assessment of the age. So
Then this
Can I just add
the helpline 1098. Everybody should remember that 1098 child helpline.
POXO we have actually.
Can I just add one line, ma'am? There's a small issue here when we ask for Aadhaar cards. There are on many occasions. This is something recently which happened to a friend of mine who lives about close to where we do. They've done a MTP for a POXO case, but the Aadhaar says 18 years of age because that particular Aadhaar card that they had mentioned only the year. But unfortunately, this MTP was done in Feb, but she was supposed to turn 18 only in May. And when this thing went to court, actually they ruled against the doctor. But luckily for her, using another lawyer, she paid up to the lawyer to the judge, and then just got the fine implemented and not the non-bailable warrant. So I feel it's very important that in case you get the Aadhaar also, make sure that the month is mentioned, because many Aadhaar cards only the year is mentioned.
So actually, in the many IVF centers, when they are going, means they are searching for all the time donors or surrogate mothers or ovum donors. Many times these girls are coming with the fabricated Aadhaar card also. So if they are giving us the fabricated Aadhaar card, it is not the responsibility of the doctor. You have to just register this card. You have to just see the same photo is there or not, and you have to just keep in your record. We are not actually, we are doctors, we are not jasus to just go for the jasus, this Aadhaar card is right or wrong. We have to just do the primary mandate things. That is, if you are seeing some discrepancy in the Aadhaar card or driving license, then only you can just ask for the uh, another card
Evidence.
evidence.
Because here in this case, when they went for the third hearing, the first thing the judge mentioned is when you get the Aadhaar card, he's saying that the recent Aadhaar card is what holds in court, is what they say. Because they're saying nowadays, since the Aadhaar can be obtained online by entering just the phone number, they're saying you should have taken the responsibility and you should have known that this can be done. That's what they mentioned, and they ruled against the doctor. Now they appealed to the higher court, but then they said finally, they said went in for an out of court settlement. But this was what the judge had mentioned, saying you should have taken the responsibility to at least enter the phone number, and all Aadhaar is available online, is what they mentioned before ruling against the doctor.
So yes, this is actually good idea. I will just keep this in my next presentation. This we can just confirm the Aadhaar card with the phone number. This is a good idea. Thank you, Ashwin. So actually, this time is just 6 by 6. So we just want to just ask Vivek sir how to respond
Yes.
the legal notice, because anyhow, whatever precaution we are taking, still one or two doctors in our fraternity, they are getting the legal notice. So is there anything you suggest to our doctors how to respond to the legal notice, sir?
Yeah. So you have to respond to the legal notice word by word, whatever the allegations are. All the allegations should be, totally taken out of the picture. So therefore, every allegation should be responded with due records. So your documents speak for yourself. So keep your documents very safely, and don't give your documents, the originals, to anybody else. It should be only given to the court at the most. So if even a policeman asks, please only give copies. And you're supposed to keep all records safely till the case gets over. So that's very important. All of you have to understand, and don't be frightened. You will not get arrested. Today, clearly cases have come up even in the courts that um, you cannot be arrested just like that. You even a complaint has to be given. The complaint should be with another doctor's before police can arrest a doctor. He has to verify the complaint and find out if there is serious criminal offense is there. So arrest and FIR is not very easy against doctors now.
Yes, actually, we are so fearful about that. Is someone is coming and just going to arrest us. So it should be very
No.
clear that the arrest is not that much easy. Just before summing up, anyone can just tell me the documentation part, how long we have to keep the documents, like delivery records or MTP records or OPD records or IPD records. Anyone can just take that question.
So I would like to say, see, all these records have to be kept till the uh, uh, case gets over. In the consumer court for 2 years, minimum time you need to keep all records. Then you have, if it is regarding the child, as a pediatric case, till the child becomes an adult, and 2 years from that. So it's 21 plus 2, 23 years. So basically, all records have to be made. And today we are in a digital world. Please keep all your records in digital form. They are very easy and they can be maintained as long as possible, because laws change with time. So as far as possible, keep all records, because record speaks for yourself, for defending doctors. Actually, records are for doctors. So as much of records you have, more documents are there, you are safe.
Sir, so before concluding, I just want to say that medicine is a science of uncertainty and art of probability. But we should not inflate by just patients are coming to our OPDs and they are just saying that you are most amazing doctor, madam, you are so good. We have to just act by empathy, not by the sympathy. And do not drag yourself in the good words of the patient and attendants. Sometimes to save money of our own patients, sometimes to just skip few procedure, we are doing certain things and then we actually drag into some complications. So you have to use the current protocols. Just many a times, just patient saying, last month CBC, we have done CBC last month only, madam. What is the need of doing CBC? No, it is the protocol. You have to do this. Because if something happens, that particular patient will say, madam, you have not advised us this investigation. So go with the protocols. Don't go with the sweet, good words with the patients and attendants. And actually flying comfortably with our patients with the rising sun even behind the black clouds is our motto. Be with your own colleagues in the time of crisis. Thank you. Thank you very much. Thank you, Vivek sir, and thank you all the lovely panelists. Thank you very much, sir.
Thank you all.
Madam,
Thank you.
very
Thank you,
discussion.
Sampath madam.
And thank
Thank
you,
you.
Vivek sir, for your expert opinion. And thank you all the panelists. Lovely panel, lot of take-home points. And yes, we have to approach the patient more with empathy rather than sympathy. And always the back of mind, it should be there. Save your skin first rather than saving the patient. So now there is a new norm. I think, saving the patient alone and put yourself in front is not the norms there. So documentation is the way you're going to save. And because now recently we had a case in our own fraternity where there was a preterm and there was a complication in the baby with the preterm, and they have just postulated that the Arabian pessary is the cause for that. And the only thing which was missing there is the consent was not there taken before the Arabian pessary because it was inserted as a OPD procedure. So when we are treating on and then if you go back to guidelines, none of the guidelines are saying that yes, Arabian is one of the replacement for encerclage. We don't have any evidence like that. So whenever we are taking, I think should properly explain that yes, it is one of the proven newer treatment which can be a little experimental, but it is that is the only option available. So if you get a disclaimer, I think we'll be better off. So if you want seniors help, I think your whole panel is there, so they will get you all the help. So anyone who wants, so you can call any of the medical legal experts. They will guide you in case of scenarios like this and how to go about that. And Foxy has a very good medical legal team. So we know that if you get into problem, please come and ask for help and they will be the people to guide you. Thank you, madam.
Yes.
Thank you.
Every time asking the help is actually good. Many times we are feeling shy, but asking the help from our seniors, juniors, colleagues, it is always helpful. And if you are having any doubt, just Foxy, my own committee, Ethics and Medical Legal Committee, is just one phone call away. Thank you. Thank you.
Thank you. Thank you, madam. Thank you for the wonderful opportunity.
Jyoti, there is one question. If parents are not coming, can we take consent from guardian like Chachi, Baba, etc.? For that alone, you can answer.
Yes, madam. We can take
Yes.
a consent from any guardian, official guardian. Many a times when relatives are not there, the headmistress, headmaster of the school, warden of the hostel, if they are just working in a small setup, and many a times this Mahila Vasti Graha, this child Sanrakshan Graha, we can just take the consent from the warden also.
Yes, fantastic, Jyoti. Wonderful panel. Now I will come to the vote of thanks. Good, you had a wonderful expert and interactive panelist. It was really useful. Whoever has not attended, they have missed, I think.
No, madam,
Anyway.
all our panelists and Vivek Madi sir are so
Fantastic.
wonderful,
Yes.
sir. And I'm
As
seeing
Shan-
Dr. Jodha
Shan-
sir there. I'm so happy to see you,
Thank
Dr.
you, sir.
Jodha, that you have attended my panel, sir. Dr.
Thank you, ma'am.
Tripura Sundari madam, Jodha sir, thank you very much.
Thank you.
So
Thanks.
that's Kalpana madam has not joined. I thought I can invite
Probably.
her for Anyway, thank you for the societies, Dr. Berili, Jodhpur, Utkala and Vijayawada, and thanks to Dr. Latika, Dr. Anita, Dr. Kalpana, Dr. Jodha, Dr. Sudharani, Dr. Sujata Kumari, Dr. Tirupura Sundari, Dr. Somalata, and a wonderful talk by Dr. Somalata. Thank you. Chaired by Dr. Anita and the panel. the moderator. Thank you, Dr. Jyoti, and Vivek Mandi being the expert, and the interactive panelist, Dr. Kalpana, Dr. Ashwin Rao, Dr. A.R. Shanti, Dr. Shisha, Dr. Sugasni, and Dr. Leena. And I thank my MOC, Dr. Priya Kannappan, and I thank Dr. Jodha and Dr. Tripura Sundari for staying till the last. Thank you.
Thank you.
Thank you,
Madam, for
Thank
giving
you.
this opportunity. Thank you so much.
I
Thank you,
take
ma'am.
this opportunity to tell that I am contesting for Foxy President. Election year is 2026. All of you, please cast your vote for me and support me. Thank you.
All the best.
All the best.
All the best.
All the best.